All right, a boost for booster shots. The CDC writing off on a plan to make sure every adult is eligible for these booster shots. At the same time, the FDA is clearing Moderna and Pfizer vaccine booster shots for all adults. The read on all of this and whether he would recommend it himself, Dr. Kevin Campbell, K-Rock Consulting President, CEO, cardiologist as well. Doctor, always great to have you. Would you recommend booster shots for all adults?
I really do. I think it's very important, Neil, that we get these boosters. The data has been pretty convincing, particularly those over 65 and those with chronic illnesses. But there is some evidence that those that are younger can benefit from these. It has been shown to decrease hospitalization, decrease death with the third shot. And also there is some small studies that actually show that it may reduce transmissibility among the vaccinated with a booster, at least in the short term, which, as you know, is probably important given that we've got Thanksgiving and Christmas right around the corner.
You know, Doctor, I always wonder, though, a lot of people are going to hear this and say, are you telling me now that I have to get booster shots? Or as some have said, Doctor, you know, treat it like your annual flu shot. For a lot of people, they say, wait a minute, we thought the vaccines themselves were a one-shot or two-shot deal, depending on what company you're using. And they're not pleased with that. What do you tell them?
You know, I think that is certainly a valid concern. But here's the thing. This is science. This is evolving. And as physicians and as regulators, we have to really roll with the punches. And, you know, as new evidence comes to light, we have to react and act on that evidence. I think what we're seeing is that the vaccines are safe and effective and they really work, but we see waning immunity. And I don't have data to suggest this, but my gut tells me you're going to have a yearly flu shot and a yearly COVID shot. I don't know that. That's not, you know, been proven yet, but I wonder if that's not going to be the case. And that's okay if it protects us.
You know what I love about your doctor? When you say you don't know something, you say, I don't know. I don't know that. But you're free to say that.
Yes,
you don't
sir.
pontificate like, let's say, a TV anchor would do. Like, I don't know, the guy talking to you. So let me ask you, Doctor, about this other thing that's going on, about getting kids as young as 5 vaccinated. Disney's cruise lines are going to require it of kids as young as 5 beginning in January, or you can't get on their boats. What do you make of that?
I really think it's very important for the youngest and most vulnerable in our population to be vaccinated. I know that there's a lot of trepidation among adults and parents out there. And what I say is talk to your pediatrician. Talk to that person that you trust with your child's life and make an informed decision. We know they're safe. We know they're effective. Everything has a side effect, but also know that this is the most well-studied vaccine in history because we've really put it through the ringer.
You know, as good as things are looking here, Doctor, we hear what's going on right now in Austria, where they're implementing a countrywide lockdown because of spiking cases. Germany is having fits and starts with this, but looking at more restrictions. Russia's a mess. I believe their death count now is a pandemic high. China, you don't know what's going on there outside of, you know, sweeping measures to contain it. So this whack-a-mole nature of the pandemic, what do you make of that and advice going into the cooler months?
I think what we're seeing is really the fallout of not having a high vaccination rate. Places like Austria do not have a very high vaccination rate, so it's a pandemic of the unvaccinated. I have a colleague in Berlin, I was speaking with him last week, and he said the same thing. We're having elevated rates, but we also have open borders. We have other European countries that aren't as well vaccinated coming into our country, and I think that's what we're seeing. Yes, there are cases in vaccinated patients, but they're mild and self-limited. The folks dying in the hospital are unvaccinated.
All right. The cases we have of people in ICUs, what percentage of them are unvaccinated?
In my experience, it's the vast majority of those patients that are in the ICU that are critically ill are unvaccinated. And I think to a man and to a woman in those situations, all those patients are saying, golly, I wish I'd have gotten the vaccine. So my message to everyone as Thanksgiving comes forward, please take care of yourself and your family and get the vaccine.
And as a cardiologist, I'm sure you're looking at all those ICU beds being taken and you wish the best for everybody. That means they're not available for heart patients or those with other needs, right?
And that's one of our big concerns, Neil. There are so many patients that have heart disease that may be scared to come to the hospital because of the COVID, surge in their cities. It's so important that you come and get the care you need. And yes, these ICU beds are at a premium. They're gold to us so that we can take care of our patients who need us for heart attacks and strokes and other medical problems. And yes, COVID does occupy a lot of them. Thankfully, in the U.S., we're doing a better job with vaccination, and we're seeing those numbers, at least in my healthcare system, really, really go down the right direction.
Thank you, Doctor.